Hi, this is Adrienne Stewart. I'm in my backyard. It's a Sunday night, evening, a beautiful day in Denver. And I have a heavy breather here named Zulu. Zulu, please look at the camera.
Zulu.
Anyway, tonight I thought I would talk about the difference between filler and neurotoxin. Now, neurotoxins are a big word for what you probably know as Botox. There's several different neurotoxins that we use. There's Botox, there's Jeuveau, there's Dysport, and there's Xeomin. They all have their pluses. They're all great, and we can go over that, what would be best for the patient when they come into the office. What Botox does is, or neurotoxin does, is that it relaxes the muscle. So it works more on lines of movement wrinkles, but it also has a few other areas that we can talk about as well. Filler, on the other hand, works more on areas that are deflated, such as cheeks. They also help folds, and they also will help like a etch line. And we can also put it in other areas as well. And we'll get into that in another talk, I think. But for now, we'll maybe talk about the neurotoxins. And neurotoxins, the areas that we can use those are in between the brow. This area in particular, I think women in particular can look very angry or unapproachable. So I think for them, it's very important to have a nice smooth area there if possible. Now, with some patients, they have a deep enough wrinkle that the neurotoxin prevents them from moving. It's a movement wrinkle, but it does not fill the wrinkle up. So some patients may need both. They may need both the neurotoxin and the filler to make it a smooth surface. The other areas that we use neurotoxins in are the forehead lines. We have to be careful there though, because we put too much in, we can make you feel heavy and you won't like that. We can put some in the lateral brow to give a brow raise. We can do the crow's feet, the smile lines. Those are happy lines. We can also put some underneath the eye to open up the eyes, and it does change the shape of the eye a little bit, but also if you have one eye, like myself, that's larger than the other eye, it can make the eyes more even. You can also use it right around the mouth where the wrinkle lines are, the smoker, some people call them smoker's lines. Some patients have never smoked, but they might just have the movement that they use over and over. The other big culprit with wrinkles around the mouth are, guess what? Straws. So get rid of those straws. Plastic, paper, get rid of them. They can cause wrinkles too. And wrinkles around the mouth are some of the hardest wrinkles to remove and get rid of. We can also use it in the GAO muscle, which is right here, that sad muscle. We can help lift the lateral corners of the mouth subtly, but it does help that. We can also put it in the jaw, the masseter muscle right here. When people clench down, they get TMJ, they grind their teeth sometimes. By putting some right in this jawline, the masseter muscle here, the chewing muscle, it can really help prevent the pain and help the grinding with those patients. We can make the masseter less noticeable. There's some people that have a wider masseter muscle, so they have more of it's wider right here. By doing the neurotoxin in this area, we can also soften that so that then their cheeks are enhanced. The other areas that we can use it in further down, this is the mentalis muscle. I brought an orange out to remind me of this. Some people have what's called peau d'orange, and that means orange skin. If you look at the orange skin close up, it's kind of rumpled. That's what can happen in the chin here, so we can put neurotoxin right in that area. We can also put it into the neck. The neck does a couple of things. There's a muscle called the platysmal muscle. It sometimes grabs the jawline here. If we soften that up with the neurotoxin, it releases, and then you can get a little lift from that. Some people call that the Nefertiti lift. Additionally, on the neck, we can use it in the platysmal bands, which are these bands here I'll demonstrate. I probably need to do myself. And then you can also do it in the neck lines, they call it the necklace lines. And some people love that, some people it's just so-so. We have a lot of other areas that we use the neurotoxins in as well. We use it for hyperhidrosis. That's excess sweating. We can use it in the armpits, the hands, and even in the feet, although the feet are very sensitive, as are the hands. So there are a lot of areas that we can use those neurotoxins in. Fillers, again, are more for plumping, and we'll go over that at another talk. I hope you'll have a wonderful night. It's beautiful here in Denver. We're having gorgeous weather today. And I wish you well and have a great week, and everyone stay healthy and well. And again, I always like to thank all those healthcare workers that are right on the front line and saving people every day, every hour, every minute. Thank you.